get dental care that doesn't cost too much. Whether you know a lot about dental or just want to learn how to keep your smile bright, you'll find something interesting here. We'll cover many topics like why brushing your teeth is important and what's new in dental technology. We've already got some questions for you and our viewers, and we'll answer them. Plus, you can ask more questions during the show. Before we start, let me tell you more about Dr. V. He's not just any dentist, he's a periodontist, which means he's an expert in certain types of dental care. He works with ToothHQ Dental Specialists in Dallas-Fort Worth area in Texas. And guess what? He's even writing a book that's coming out next year. If you want to know more about Dr. V, check out our website at www.mytoothhq.com. So let's get comfortable and ready to learn lots of cool stuff about taking care of your teeth. Let's begin our dental live show. Welcome everyone. And now let's welcome Dr. V and start our show.
Hi everyone. I'm Dr. Kumar Vadivel, but you can call me Dr. V. I'm very excited to be here for another show with you all today. Let me tell you a little bit about myself. I'm a board certified periodontist, which means I'm specially trained in taking care of gums and bones that support your teeth. I'm also skilled in dental implants and oral surgery. I am part of the American Academy of Periodontology and the American Board of Periodontology. That's a fancy way of saying I work with a group of dentists who are experts in gum health. I started ToothHQ Dental Specialists, and we have 4 offices, as you guys know, in the Dallas-Fort Worth area. We are all about making sure your teeth and gums are healthy and strong. Now I'm here for you. I would love to hear more questions. Either you might have here right now, or you can just send them to us for our next show. Your question really help us make these shows really strong and really helpful, not just for you, for everyone around the globe. And one more thing, if you really like what you're learning here, and please let us know. And your feedback is super important to us. Don't forget to like or subscribe to our channel so you won't miss out on the latest and the greatest updates and helpful tips that you need for your dental health. I'm looking forward to having a great time with you all tonight and answering all the questions, and let's make our smiles as best they can be, right?
Absolutely.
All right. Let's do it, man. Yeah. Awesome. Okay. All right. Cool. Yeah.
So, doctor, do gums grow back after gum contouring?
No, the gums usually do not grow back after gum contouring because the procedure permanently reshapes your gum tissue. And that's the purpose of the gum contouring. If the gum contouring only temporarily removes the tissue, it kind of beats the purpose. So the gum contouring actually removes the gums permanently. So that way, whatever the reason you're getting the gums removed, either for getting a filling or getting a veneer or anything, so it stays permanently that way.
Very nice. And does Invisalign cause gum recession?
Invisalign does not cause a gum recession per se. However, you need to know whether you have some existing gum recession to begin with, so you decide whether this is going to cause your gum receding worse or not. So Invisalign per se is not going to cause gum receding or gum recession, but it can make it worse if you have not a good gum condition to begin with, or you have gum recession to begin with. So the best way to do that would be to make sure that you are going to talk to your dentist or the orthodontist, whoever is going to do the or whoever is doing the braces. Make sure that you are a good candidate for Invisalign or not, or you are going to have any gum receding or you are at risk of gum receding or not.
Got it. So, Dr. V, I often have swollen lymph nodes in my neck. Can a dentist make first level diagnosis?
Absolutely. One, a dentist can perform first level evaluation of your swollen lymph nodes as a part of a routine exam, which is what we do, and we call it as a cancer screening exam. Number two, swollen lymph nodes can be linked to infections and including gum disease or oral infections, which the dentist should be able to assess. And then most importantly, a swollen lymph node is going to be an indication of you may have cancer, particularly if you have any non-healing ulcers or any type of like swelling inside the mouth. So it is very critical that you bring it to the attention of the dentist, or when the dentist is doing the exam, they should be able to pick it up. And number three, if you have swollen lymph nodes and they are particularly persistent, or if they are not related to your oral health, your dentist is now going to refer you to your doctor, meaning like an MD doctor or like an ENT doctor or a cancer doctor for further investigation.
Interesting. So, my teeth are more sensitive when I am eating hot food, but not cold food. Is this usual?
Absolutely. It's not uncommon what we say. So, number one, sensitivity to hot foods is very common, especially if there is gum recession or if you have like the enamel is kind of eroded. Number two, it could be a sign of dentin hypersensitivity. What that means is you have exposed tooth roots, or you have exposed teeth, and now they are prone for temperature changes. Number three, the cold sensitivity tends to be more common than the hot sensitivity, but that doesn't mean that heat sensitivity is not common, and it can also occur due to issues like enamel erosion or sometimes tooth decay also. And number four, make sure that you are going to see your dentist for a thorough evaluation and a potential treatment if there is a possible heat sensitivity, and the dentist can help you with either fluoride treatment or even simple treatment like giving you some desensitizing toothpaste.
Very nice to know. When is bonding recommended, and when are veneers?
So the question is the bonding versus the veneers. Number one, bonding is ideal for minor issues like very small chip in the tooth or very small gaps or discoloration. And bonding is quicker. It is less costlier than the veneers, and it may not be as durable, but whether you are a candidate for bonding or veneers, then you will need to talk to your dentist. Number two, veneers are better for more serious concerns, such as you may have either severe discoloration or the chip on the tooth could be larger that cannot be fixed with bonding, and the veneers provide a more natural, long-lasting solution, particularly if the damage is bigger. And number three, veneers are definitely stronger than the bonding. I'm not going to say bonding is not stronger, but particularly if the damage is bigger, veneers tend to be a lot stronger compared to the bonding, and making them suitable for those seeking a higher quality, more permanent, long-lasting result.
Very nice. So, Dr. V, I have some plaque buildup in my molars. Am I using the wrong size or type of toothpaste, or am I missing a specific technique?
Great question. So, number one, plaque buildup on molars are common due to hard to reach location, because you may be thinking that you're brushing it properly, but you may not be reaching it properly. And when you come to our offices, and not just the brushing and just not the flossing, we have several tools that we recommend to our patients, such as what we call it as a sulcus brush, or we call them go in betweens, or like the Proxa brushes. Number 2, use a smaller toothbrush head or an electric toothbrush for better cleaning, because you may be using a wrong brush head size, or you may be using like the wrong texture of the toothbrush. Either you could be a good candidate for a medium, you could be using a softer toothbrush, then your plaque buildup tends to be more if you are not picking the right texture of the toothbrush. Number 3, angle the toothbrush in a 45-degree angle towards the gum line and use in a small circular motion. For example, whenever you go to your gum, so you're kind of angling it, go towards the gum line like this and then go in a circular motion. People tend to brush their teeth. And I always say, it is not brushing your teeth, it is brushing your teeth and the gum. So you got to go towards the gum line and go in a 45-degree angle, go in a circular motion. And number 4, spend the extra time on molar teeth, particularly the back teeth, and do not forget the inner surface of the teeth, and particularly the inside of the bottom teeth tend to build like a lot of plaque. Inside of the front teeth tend to build like a lot of tartar. So you need to spend more time. And I usually tell my patient, hey, spend the extra 2 minutes on the shower when you're putting in your conditioner, for women particularly.
Mm-hmm. Yeah.
When you put in your conditioner and you're waiting for like a 45 seconds to like a minute,
right?
Do the brushing at that time, right?
Yeah.
So
absolutely.
who would not want to spend the extra minute on the shower, right? At the shower. So spend that extra minute. I don't care even if you put toothpaste or not. Just brush your teeth, even with no toothpaste on them. And number 5, floss daily or use the interdental toothbrushes that I mentioned earlier, and particularly to go in between the teeth to minimize the plaque buildup. And number 6, persistent plaque may need a professional cleaning. No matter what you try to do, it is not going to get better. Make sure that you are going to visit your dentist, get your professional cleaning, particularly the harder plaque, which we call it as a tartar. They will need a professional cleaning.
Oh, that's the one that you can't really brush off with your
You
teeth.
got it. You got it. Yes, ma'am. You got it. Yeah.
So, Dr. V, I heard that dental laser radiation can cause mouth cancer. Is this true?
Absolutely, it is not. Dental lasers are not radioactive and they do not cause mouth cancer, number 1. Number 2, lasers focus on light energy on specific areas and without harming the surrounding tissue. So you don't have to worry about not only the laser causing the cancer, but causing damage to the adjacent teeth. Number 3, they are very safe and they are very effective tool for treating a lot of dental conditions, including the gum disease and preparing cavities and a lot of more applications. But again, talk to your dentist or the periodontist and they can definitely help you.
Very nice. You learn something new every day.
Absolutely. Yes, ma'am.
Okay, so can osteoporosis affect your jawline?
Absolutely. Number 1, yes, osteoporosis can affect your jawbone by reducing its density, making your bone more prone for bone loss and weakening the support for your teeth. Number 2, this can lead to gum recession because your bone is receding and you have tooth mobility, or even you may have tooth loss in severe cases. And number 3, it is important to manage the osteoporosis through medication, which you need to talk to your doctor about, and a healthy diet and regular dental checkups to monitor your jawbone health. And most importantly, you need to make sure that you are going to the dentist on a regular basis, because if you have osteoporosis and if you have been put on certain medications by your MD doctor, then you are not a good candidate to have any type of dental surgery done. Because if you do get dental surgery done, if you are on certain osteoporosis medication, it can cause some irreversible damage to your bone. So talk to your dentist and make sure that you are taking the osteoporosis medication. But to answer your question, yes, osteoporosis can cause a variety of bone damage in your mouth,
Wow.
particularly on women.
Oh my goodness.
Yeah, because women are more prone to taking the osteoporosis medication than men,
Men
right?
are.
Yeah.
Yes, you're
Yeah.
correct. So after laser cleaning, why has my teeth sensitivity increased?
Great question. So the reason, one of the reasons why after the laser cleaning, the sensitivity increases because the light, the energy or the heat that you get from the laser, it kind of opens up it's almost like opening up this after your dermabrasion or after the facial that you get, you open up the pores the same way the laser opens up the pores on the surfaces of the teeth. So that's a reason why now it is kind of open. Now your teeth are going to get sensitive. It is not a permanent condition. The teeth getting sensitive immediately after the laser. They tend to get better on their own immediately after the laser or after a few days after the laser. But if they happen to stay sensitive, talk to your dentist and very easy fixes. Either they can do some local fluoride application, or we call it as a desensitizing agent application, or as simple as you can start using some desensitizing toothpaste like Sensodyne over the counter, or talk to your dentist and we should be able to prescribe some really strong toothpaste like an anti-sensitizing toothpaste, and they're all going to really help you.
Oh, that was a great visual. So my teeth are not loose, but I'm concerned. Can digital x-rays or intraoral cameras detect bone loss before teeth begin to loosen or shift?
Absolutely. Digital x-rays are great tools, and particularly, you've been in dentistry, so we know that we do a certain x-ray called bite wings, which means, we are going to have you bite on like a piece of wedge, and then we are going to do some x-rays. We call it as a bite wing x-rays. And the ones that we do take without those bite wedges are called periapical x-rays. They detect the early bone loss and before the mobility occurs. Intraoral cameras can visualize the gum recession, the plaque, and the early inflammation, but they cannot really show the bone level in between the teeth. But if you have gum receding, that means that is an indication for the bone loss also. Regular cleaning every 6 months, it tracks changes and detects the early periodontal disease. And then depending on the amount of bone loss that you have, the dentist may decide to repeat some x-rays. And early detection allows for timely intervention, improving the long-term prognosis, and combining your clinical exams, which you are going to get with the dentist, along with these x-rays, which we call it as an imaging, provides the most accurate assessment of the bone level, whether you have any bone damage or that may end up causing your teeth to become loose.
Interesting. Wow. So, doctor, my dentist has advised gum grafting for my severe gum recession. Are there any non-surgical alternatives available?
Severe gum recession usually requires gum grafting for best results. Not necessarily the severe gum recession, but any gum recession. I wish, the gums grow back, by themselves, but they do not. Very rarely they do. Non-surgical options are very limited. As I said, you really cannot have gums grow back on their own. Like, for example, for periodontal disease or gum disease, we call it the deep cleaning as a non-surgical option, but there isn't such thing as a non-surgical option. However, there is some hope to what we call it as a minimally invasive option. For example, we do either a pinhole technique or like a small, like a minimally invasive techniques, or some laser surgical options that we do, which can fix the gum receding, which are the not non-surgical, but a minimally invasive option. And these methods are minimally invasive because they can help reposition the gum tissue without extensive surgery and stimulate the gum tissue to grow, cover the roots which you have some gum exposure or the root exposure. And the difference between the regular surgical technique and the minimally invasive technique sometimes could be the same, or they could completely differ, or differ to a degree. Whether you are a candidate for a regular conventional gum surgery or a conventional gum grafting, or you are a candidate for a minimally invasive, you can talk to your periodontist and then they should be able to answer that question for you.
Great to know that. So, doctor, can high blood pressure affect my gum health?
Absolutely. Gum health can impact not just your blood pressure, but your overall health. Again, definitely it is going to affect your blood pressure. Research shows that gum disease, particularly when it becomes severe, can contribute inflammation to your body, and which may affect your blood pressure levels. Managing your gum disease is very critical with regular dental checkups, good oral hygiene, and treatment, if necessary, can help definitely lower your risk for potential complications from high blood pressure. And this is what I normally tell my patients. And hey, not necessarily there is going to be a direct relation, but what we normally see is when you start treating your gum disease, you don't need to be on the higher dosage of medication. Then we see that patients tend to take a smaller dosage to control the blood pressure. So it is always a good idea to discuss any concerns that you have with your dentist as well as your healthcare provider to see whether there is or what kind of a relation your gum disease will have with your high blood pressure. So both your dentist and your MD doctor can help you.
Cool. So, Dr. V, is sedation available for patients with COPD who need dental procedures?
Absolutely. Sedation is an option for patients with COPD who require dental work. Again, it really depends on the risk that you have, how bad of a COPD that you have. And we offer several sedation options, with minimal sedation being like nitrous oxide or the oral sedation, or even IV sedation, or if you have severe COPD, if you are still a candidate, if we seem that for any type of sedation, we even bring in some dental anesthesiologist or an MD anesthesiologist to put you to sleep to get the dental work done. It is very critical that you discuss your COPD condition and particularly the severity of your COPD condition with your dentist beforehand so they can help you select the level of sedation tailoring to your needs. And anytime you have COPD that you may or may not be aware of the COPD, we coordinate with your MD doctor. So either if you are seeing a pulmonologist or your lung doctor, we coordinate with your lung doctor, or we coordinate with your MD, and we can help you decide on the level of sedation that you're going to need. Either the sedation can be done safely in our office with the same provider who is doing the procedure as well as we do the sedation. If necessary, we are going to bring in an anesthesiologist to make sure that your safety is most important for us.
Absolutely. Thank you. So, as I'm nearing 50 and I'm noticing gum shrinking, does it reside with age?
The gums are shrinking, meaning that I can only think of you're probably like referring to the gums kind of receding, which you are referring to as shrinking. It is not uncommon for you to still have healthy gums, but to have some receding or the gum shrinkage that you are referring to. Whether you have active disease that you need to be really concerned about, that you need some treatment, that I can't answer without looking into your mouth. So the best judges will be your dentist. So next time when you go, ask them, hey, doc, do I have active gum disease, which is what is causing the gum shrinkage, or my gum shrinkage or the gum receding, what we refer to as is related to age. And your dentist should be able to answer that question for you.
Okay, so, Dr. V, I struggle to find time to thoroughly floss. Are there any easier DIY alternatives to replace it?
So what you're asking is, is there any way to cheat, right? That's what you're asking. I really wish, there is a way to cheat. But going back to, had you told me like, hey, I struggle with flossing, so instead of finding time for flossing, I possibly could have given you a solution, but there is no alternative to the time. So the only thing that I can think of would be an alternative for the time that you need is, instead of finding time in front of the mirror after you brush and to find the time for flossing, just floss when you're in your shower. I'm sure you will find the extra time to stand in your shower for the extra minute or two. So floss when you are in your shower, then there we go. That's your time. So you can be multitasking. You're showering or you're waiting for your conditioner to work for the extra minute and you could be flossing. So while flossing is the most effective way to clean in between your teeth, there are alternatives we can help you. Either you can get a floss holder, or we can get the interdental brushes, which are the tiny bottle type toothbrushes. They go in between the teeth like this. So those are great options. Make sure that whenever you're using the interdental brush, you're going from the outside of the tooth like this and then come on the inside like this. So they are slightly quicker, easier to use. As I said, not just the time, like if you had struggle with using that, they are slightly easier to use. They can clean in between the teeth, as effective as flossing, but maybe not the best as compared to like a traditional floss in some cases. And then you can sometimes use the water flosses like or the water pick, although they are not the best because you really can't spray the plaque away. So you really need to really mechanically scrub it away, which is what the flossing does by putting in the thread and you're slicing the plaque away from the tooth, which is what you do. But that cannot be done with the Florida water flosser. But I always tell my patient, hey, something is better than nothing. So I can't force you to do that if you're struggling with time. So do something what is going to help you. If you can carry your interdental brush, and can you do that while you're driving? Drive safe, but you can do it when you're driving too. And these water flosses and water pick, they send a stream of water to remove the plaque and in between the teeth. So talk to your dentist and see how your oral hygiene habits are, how you're doing, if you're using anything other than the brushing and the flossing, and they should be able to help you.
I'll definitely keep those tips in mind.
Absolutely. Yeah.
So, Dr. V, my dentist informed me that my current pocket depth is 5 millimeters. What do you recommend I do next?
So a pocket depth of 5 millimeter is considered what we call it as a moderate periodontal disease, and it is important to take preventive steps to prevent any further progression of the gum disease, particularly if this pocketing is related to, and more often than not, like it is related to some type of gum disease. I would highly recommend you consider possibly considering a deep cleaning, particularly if your dentist has already spoken to you about getting a deep cleaning, what we call it as a scaling and root planing, to remove the plaque and the tartar, particularly that is below the gum line, not the one that you see above the gum line. I'm talking about the one you may not be able to see below the gum line. If necessary, the dentist might recommend, or the hygienist might recommend, doing some laser therapy, which I highly recommend you consider to promote the healing at the time that you are going to get the deep cleaning. And most importantly, a regular follow-up after the deep cleaning, after the laser. It is not a one and done. So you need to still go back to your dentist for your regular maintenance, particularly when you have gum disease, you can't go back to your regular autopilot mode of every 6 months cleanings, or you go to your dentist only when you have a problem. Particularly if you have gum disease, make sure that you are going to go back every 3 months to maintain the pocket depth, maintain your oral hygiene, and maintain your teeth, and you don't end up losing your teeth. It is very critical.
Got it. So, doctor, I recently noticed that my breath has a strong odor. I haven't changed my diet or started any new medications. Could stress and anxiety be the cause of halitosis?
Absolutely. Stress and anxiety can cause halitosis by reducing the saliva production, leading to a dry mouth, and you know this, when you're stressed out, you're probably like not drinking a lot of water. See here, this is my Bubba cup. I have it at my desk, and this is a 55 ounces cup. I keep drinking. Let me take a sip of water.
Take a sip too.
There we go. Yeah. So you don't drink enough water, which is going to cause a dry mouth, which is going to cause a bad odor, which we call it as a halitosis. To manage this, try staying hydrated. Bubba cup is the answer. Practicing stress relief techniques and like deep breathing exercises, or maintaining different oral hygiene or a better oral hygiene, brushing more often, and chewing a sugar-free gum, but don't overchew, then don't end up causing some what we call as a TMJ or a jaw issues. And if necessary, consult with your dentist or talk to your doctor about like your stress kind of causing some of the issues, and whether there is anything that you could be doing to decrease your stress, which is going to help you with your bad breath.
Very nice. Maybe working out will help too.
Yeah, absolutely. Yeah. So does working out like help you relieve your stress?
Absolutely.
Yeah, there we go.
Even if it's 30 minutes, you know. Just kind of getting out
Even
there.
taking a walk, I'm assuming, right?
Oh, yes, walks are amazing.
Take a deep breath when you're walking, right? Yeah.
Absolutely. I didn't know that could contribute with helping with that, but that's awesome to know.
Well, take a breath of air, right? Yeah, brush.
Yeah, absolutely. Yeah. So my dentist recommended using the Perilace MVP 7 for my gum recession treatment. Is it FDA approved and safe?
Yes. Number one, the Periolace MVP 7, which is what we call it as a LANAP laser or the Millennium laser. It is an FDA approved laser, and particularly for the use of what we a procedure called LANAP, which means laser assisted new attachment procedure. That's what we call it, the LANAP, LANAP. LANAP stands for laser assisted new attachment procedure, and other periodontal treatment, including gum recession. Whether your periodontist or the dentist is going to exclusively use the laser for correcting the gum recession, it is not possible. So you need to have some kind of either a minimally invasive procedure or a corrective procedure. So per se, they are not going to use the LANAP procedure for correcting the gum recession, but the LANAP is a procedure being done to treat gum disease, which is what the Periolace MVP 7 is approved for. And it is safe, and it is minimally invasive laser option. Particularly if you read the MVP 7, we are going to say no cut, no sewing, no pain. So you're not going to have any cuts, you're not going to have any sewing to be done, and there is no pain involved, or very minimal pain involved. And it has a great track record for effective outcomes for treating gum disease. And if you have any concerns, it is always a good idea to talk to your dentist. And it also, more than likely, if you have a Periolace MVP 7, very minimal dentists carry that, but a lot of periodontists carry that. So talk to your periodontist and why they are recommending what they are recommending, because if you have gum recession, they will explain to you how the Periolace could be using the Periolace to treat your gum recession. But if you have gum disease, then they are going to definitely tell you how the periolase is going to really help you to treat the gum receding. In addition to the deep the either the scaling and root planing or the deep cleaning you may need to have done at the time of the procedure, or it could be a replacement for what we call it as an osseous surgery or the gum surgery. So talk to your periodontist, talk to your dentist, and why they are recommending what they are recommending, and they should be able to answer those questions for you. So I think we are on time now, right? Yeah, almost. What time is it? Like it's almost 8. Yeah, okay, all right. Well, thank you all for being the loyal supporters for our show, and we thank you all very much, and we definitely look forward to seeing you guys next time. Thank you so much.
Thanks.
All right.
Awesome.
Good job. Thank you, man. Appreciate it.